Well, good afternoon, everyone. My name is Janice Davis Street, and I'm a member of the board of Heroes Board. It is my distinct pleasure to welcome to our session Dr. Apoorv Gupta and Khalid Turk, who will be sharing with us on this very interesting topic. Dr. Gupta's and Khalid Turk's resumes or see bios are on the site, so I will not take any of their time um, in taking away from their presentations. But I just love the name of your organization, a loving organization. It just feels like it fits perfectly with the topic that we are highlighting today. And I think with that, I'll turn it over to your very capable hands for you to lead us through today's session.
Very
We,
good. Thank you. Thank you so much. We do have a PDF of the presentation. I don't know, Bailey, if you have that ready to go, or do you need us to launch it from our end?
Um,
Just to, as a guide on the background, do you need us to bring that up?
my hope was that you would pull it up, otherwise I can
Yeah,
quickly find it.
yeah,
we should be able to pull it up. Meanwhile, while Khalid is doing that, we're both here together. You know, since this was originally scheduled to be in person in Berkeley, and Khalid is based here in Southern California, I already had my plane tickets booked, and I thought I'd take advantage of that. So we get to meet. We've been working together for a little bit, but we haven't met in person. So here we are, and we thought we'd take advantage and actually be on camera together as well. So this isn't thanks to AI. This is actually our own version of being live to be able to share, our thoughts with you. My background, as you heard briefly, I am a internal medicine physician. I worked as a hospitalist for many years, medical director of a hospitalist group, and then I've kind of worked in various roles in administration as a chief medical officer. And then for the last 12 years, I've really been in consulting, performance improvement consulting with a few different firms, essentially helping to fix things, as they say, on the healthcare side, particularly anything having to do with clinicians. So it could be things like clinical outcomes, or it could be programs like emergency room or ICU. And over the period of the last 8 years or so, I've gradually gotten deeper into the culture transformation part of the business, which is what has led us to this work that, I'm now a part of this non-for-profit that Janice just introduced, a Loving Organization Consortium, which we'd be happy to talk about with you. And through that is how I met Khalid. So I'll turn it over to my esteemed colleague, and he can introduce himself briefly.
thank you. I hope you can see our screen. I just confirming that. Yes, okay, thumbs up, great. My name is Khalid Turk, and I'm honored to be here in the company of Dr. Gupta, who flew in all the way from East Coast and just for this presentation. So it's quite an honor. Uh, my name, as you know, is Khalid Turk, but title is Chief Healthcare Information Officer. I work for the County of Santa Clara, a public sector organization where we provide healthcare services to the residents of County of Santa Clara, about 1.8 million. We are one of the largest healthcare providers in the state, second largest and seventh largest in the country. So we are significant, and we take away pain from a lot of people, luckily so. I represent IT, but the services we provide through myself and my team, they actually enable our providers, nurses and doctors and many others to take care of the patients. So kindness and love is integral part of that. Though we are not on the front lines of actually touching the patient and taking care of them, but we do enable the actual care providers to make sure that they are doing that. How you're going to share?
I'm not
This
sure
is
this will
something.
project.
It's
Can we get it
on
to
my
project?
table because this
Yeah.
is the core principle of my leadership, which is in a world where you can be anything, be kind. And I've been in the industry, healthcare, for 25 years. I've done almost every type of IT work that you could do, from cleaning the desk to put a computer to lead off a team of 240 people that I do now. And how we have been successful to lead with kindness and meet some of the really daunting and challenging milestones through a team of extremely brilliant and committed resources. That'll come up as we go through the slides. So with that, I'll invite uh, Dr. Gupta to tell us the goals of today's presentation, and then we'll go slide by slide.
Thank you. Yes, and thank you again, MJ, for inviting us to be here. Really, really appreciate it, and the opportunity to kind of be able to talk about how all of this stuff comes together. And it's not about the semantics and the labels. It's about the work and about really making the work stick, and making it impactful, making it measurable. That's sort of what we're all trying to do. So this is just an incredible forum that you've assembled here and a great opportunity. So here are our goals for today, and hopefully we'll be successful at these in about 50 minutes or so. Please give us your feedback and share your thoughts. The first is that we have developed a model we call Integrate, which is a acronym really for a systems-based approach to develop love, kindness, and compassion in organizations. And so we'd like to share that model with you and understand how can a framework and a model like that help us to take this work forward. Our second goal is that we hope that kind of solutions, that systems-based approach, allows us to build systems that create psychological safety, respect, and mutual care. And we hope to share that with you. And hopefully we'll have a chance to do an interactive exercise as well with you, where we can explore some of that. And then thirdly, we've also got a little bit of tools that we've developed that we hope will be able to help you, each of you, develop your own individualized action plan that you can then take back to your own settings and figure out, how can I implement this starting tomorrow, Thursday morning? What can I do about this? So those are our goals, is to really make this real and practical, and to kind of show you how taking a systems-based approach really allows us to embed kindness much more deeply into the organization.
Yeah, and Dr. Gupta, I'm new to this philosophy and methodology, but one thing that I found really beautiful, that yours is not just a framework that needs to be published in textbooks. This is something that you can implement the right away. And when Dr. Gupta reached out to partner with him for the presentation, that was the immediate selling point for me, that this is something that could be done. It's not like a pie in the sky. So with that, we will move to the next slide.
Thank you, Khaled. I really appreciate that because, again, I feel like you are the perfect example of someone who's actually doing it. So, which is what we wanted to share with you, and this is what the Hero Forum really wanted us to share with you. Is not just as something as a potential concept or a framework, but really in partnering with folks who are actually implementing the work on the employer side. And Khaled is a brilliant example of that. So I'm just so excited that this opportunity came about through this forum. Well, to kind of set the frame, for us, really, the challenge is that the roots of incivility are really, really deep. And they go down to the level of a primal fear, which you could argue is the oldest thing in the world, in the universe. It goes back thousands of years. It's probably just as old as the oldest thing in the world, which is love, right? And so they both kind of come into being around the same time, depending on your spiritual paradigm or philosophical paradigm. Hopefully, some of you will understand that the roots of fear, which are the roots of incivility, are truly long-standing. And that's kind of why we thought, in order to frame up our approach, it's important to understand that we need to deal with this at a deeper level. When we're talking about moving from incivility to kindness, it's not just about the superficial values and behaviors that people may exhibit that need to ultimately change. We're not trying to necessarily modify actions at that level and really act upon it more at the individual level. We believe that the roots are actually much more systemic and deeper. And therefore, if we understand those roots and understand that fear is the basis really for how incivility is presenting, especially in the workplace, but also in society in general, then we can actually take more longstanding, durable, sustainable solutions towards them. So from a high level perspective, I think what the messages we would like to communicate to all of you are that most of management in workplace settings, in the default mode, really tends to rely on a fear-based management. Top down, command and control, patriarchal. I'm going to tell you what to do, and you're going to do it, and then I'm going to come back and check and make sure you did it. And then if you didn't do it well, then I'm going to go through a series of escalations to remediate you, maybe censure you, admonish you, punish you. And all of these things are actually fear-based. We just don't recognize them as such because we've been living and practicing this way for all our lives. And again, for decades and centuries and millennia. A lot of that comes from suppression of voice. because individuals are not able to speak up when they feel that they're going to be punished. That creates resentment, mistrust, and resistance. And over time, that frustration then leaks out and starts to present itself in subtle forms of what I think we would call incivility. That is the eye rolling, dismissive comments, some passive aggressive behavior, gossip, informal, indirect, behavior, because people are not don't have the atmosphere of psychological safety in which they can speak out. Again, deeply rooted in a fear base. The other way in which this presents is in survival mode thinking, because when we're operating in fear, that triggers our fight, flight, or response, freeze response. And instead of thinking, how can we work together, collaborate, solve problems, we actually go into self-protection mode, and that presents in its own range of incivil behaviors. When we're fighting, when we're sarcastic, we're rude to other people, we're cutting each other down. When we're flighting, I guess I'll say, we're withdrawing, we're ignoring colleagues, we're withholding information. We think the problem will just go away on its own. And then when we freeze, we disengage or stonewall or engage in other passive aggressive behaviors. All of these are also eroding civility. And then finally, we think that fear creates this sense of competition for limited resources, time, and recognition. And we think it's a zero-sum game. And the only way I can get ahead is if my colleagues don't get ahead. So we wind up developing a scarcity mindset. And in that scarcity mode, we wind up normalizing uncivil acts like interrupting each other, hoarding information, undermining others to get ahead. These are ultimately resulting from systems, even if we don't realize that these systems are at play. And our goal here is to bring forward to you a little bit more of some of these invisible systems so we can think, how do we address these? If fear is such a root cause of incivility, and fear is what's currently operating the systems, then what do we do to make those systems kind systems instead? So we'll to get into that, but before we do that, I would like to have my colleague Khalid talk a little bit about how he's been thinking about kindness here at Santa Clara.
Thank you. Yeah, thank you, Dr. Gupta. You mentioned about the top-down structure approach. I think leadership has been through the transition and leadership as well as corporate culture. There were times in some corners, there could be still the times where the meanest you are, the better boss you are. Those things have changed. And that change turning point was somewhere in the 90s with this term emotional intelligence came in. When we started educating people that humans are emotional beings, and it's not like the fear that drives them. Actually, there are many other factors that drive even more effectively than the fear itself. So that brought a change in corporate culture since 90s and now. And there was another factor in play, which is, and this is slightly newer discipline. Some people call it pseudoscience, but I have written a book on that. I believe in that, which is that different age groups. Boomer is not just a term and not necessarily a derogatory term, but then they were Gen Xers, millennials, and then Gen Zers and alphas. These are really different type of people. I'll go on briefly on a tangent, but come back to this slide, and also need to switch my slide over here, that those who have had are raising kids recently, teenagers or even young adults, you will see the contrast, the difference that between us when we were teenagers and them. One thing is natural, every generation is different than others, but there are so many factors. Many people put it on the being digital native, on the mobile phones and smart devices and whatnot, but there are many, many factors. We both agree when we are comparing notes, Dr. Gupta and I, because we have uh, kids in similar ranges, is that we have definitely dealt with different species, for lack of better word, when raising those kids. And where that was coming from, the whole society, based on the information that has been trickling down, has transformed. People don't respond to the fear, to the pressure, to the any type of punishment. Actually, incentives work more meaningfully than any type of fear, and that we have seen in the corporate culture. Right now, one of the biggest challenge for me and many others who are responsible for continuing to run the organizations, attract the best talent and retain that, they have learned that they are at the mercy of a newer generation. No matter what they do, you have to play at their terms. If they don't want to come to office, you have to meet them where they want to be. Probably being fully remote is not an option. So we negotiate. So all these things have tilted the balance of power from the corporate structure to the human being. Human has always was a center, but that was center was used somebody that could be coerced. But in the new paradigm, the new world that we live in, and there are many factors for that, that piece of the puzzle is more empowered. And when you look at some of the aesthetics over here, and there are so many research that I can point to, that kindness is actually a tool. Like even honestly, 15 years ago, when you tell somebody to be kind, they would laugh at you. Yeah, you're such a whatever word that comes to their mouth. But now I say, yeah, kindness is a tool. I'll just you can read the slide, but I'll share you couple of things and real example. This is not examples that I read somewhere in HBR and some other resource. I have lived through. I'm an immigrant here. I've lived in America for almost a quarter century, little over. And my first job in one organization, I won't name them, there was a culture of coercion and top-down structure, lip tight. You cannot, there is no open door policy. You cannot talk with your boss unless they invite you to open your mouth and talk with them. In that environment, we build a system. And there are so many aspects of this story, but I'll try to make it simple, just tell you that at the end of that product, where one of the largest healthcare organization was involved, along with one of the largest at that time and even now, IT consulting organization, the product cost about, Dr. Gupta, 200 million. And this is I believe the case that has been discussed many, many times in different educational and other settings. And what happened that that product was not going to work from the get-go. And this is way before the psychological safety research was done at Google, which was around 2015. I'm telling you the story from 2000, 2001, and 2002. Once the product was built, and it was built by the best of the programmers and system engineers and project managers and IT gurus, it was presented to the users. Nobody liked it. Long story short, that software was put in the dustbin. It never saw a light of the day for two reasons. Number one, there was a disconnect between the user and the developer, which is a different story, not part of our conversation. More importantly, the people who were building it, majority of them were extremely smart. Nobody had a courage in that culture to speak up, hey, what you're doing is not going to work. Because everybody was trying to uh, preserve their job or their dignity because there was no kindness in that culture. And in my early days, I was a young adult then, I learned that, oh my God, when I get a chance, I'm going to do things differently. And throughout the years, not only I've learned, but read and studied that kindness is not something that is equal to being weak. Kindness is a strategic tool that you use, that how you engage people so they are enabled and they feel psychologically safe to make you aware of your blind spots. No matter how smart we are, our eyes only see a certain in a special in the what we see in front. So all the blind spots we cannot see. But when you lead with kindness, when you lead with love and eventually build towards a loving organization, you have thousand eyes in that organization. Everybody is looking from a different vantage point, and when they see a risk, you give them courage by speak up because your values are rooted in dignity and respect. And these are the core values that have helped me. And this is where Dr. Gupta and I connected to partner on this presentation. Coming back to the slide, and these are by the way, if you Google or GPT any of these, you will find out the actual numbers behind that. Some of these statistics are copied from the McKinsey research, others are done in many other research. But the truth is that if you compare the organizations that are performing really well versus the organization they are struggling, the one of the term that come up is psychological safety, but psychological safety is not something, a plant that you'll bring and put it on the table. It is that is you build by giving people a voice, creating a culture where people feel valued, people feel not non-threatened, and people feel respected. And that's how they open up. And that's how organizations thrive and they actually contribute to their bottom line. With that, uh, what we are doing here in the county of Santa Clara, where I work actually in my current role. When I took this job about 5 years ago, and it was chaos, and the chaos was COVID, not because the organization was chaos. We all were thrown some challenge that no school, no experience had prepared us for. So everybody was looking for a direction, and luckily I worked in an environment where the leadership was very supportive, and we built this culture where we enabled every voice to be heard and come up with their solutions. I'll tell you some of the things that we did at that time without any prior experience. Where I'm sitting now, the 49ers Stadium is not far away, literally like a stone throw away. That stadium we converted into a vaccination site for 5,000 visitors daily in less than 2 weeks. How that happened? That was rooted in the culture, not only of the commitment, but also where everybody felt valued and loved and cared for. So they were bringing their 100%, where many people were not even going out to pick their groceries. We were out there working with other individuals to make sure that we create the infrastructure that's going to take care of about 2 million people that we serve. So this is just one example that how we have transformed the culture from the hierarchy and structured to love and care and kindness, and that has enabled individuals that they bring their 100% no matter what challenges we have faced. Very recently we had another challenge that we acquired a hospital, and this has never happened in the history of healthcare in America. We brought that entire hospital of about 250 beds in our fold in less than 90 days. If you talk with any consulting firm, they will tell you that it's not possible in less than 9 months. How that happened? Again, creating a culture of empathy, kindness, and engagement. And this is how the people feel empowered and they bring their best. And at the same time, you are not driving just by your own self, but every eyes in your vehicle that is moving forward is working for you and navigating for you.
Wow. That's just that's really incredible. It's powerful to hear Khalid talk about it. Every time I hear him talk about it, it's incredible because it's real lived experience, and we've all gone through it. We've all gone through the chaos of COVID, and we have actually heard in some cases some of these stories of organizations that have been able to respond with compassion and empathy during COVID. And so I guess I would call that the dynamic kindness, which is evident and it's present. It's present inside all of us as individuals, and it's present inside all of us in a latent capacity within organizations. It's just that somehow when we don't actively channel our systems along those same lines, then we don't harness the full potential of it. So we can experience during moments of stress. We've probably all heard about emergency rooms in hospitals that are somehow able to rally when they're facing an onslaught of, potentially maybe some sort of a major accident in the area, and everybody rushes to the scene, and you have incredible resources being poured in, and administrative as well as clinical resources, and we all rally to the cause and are holding hands and supporting each other. And yet somehow, even in the aftermath of that, we sometimes lose that. And I think that's kind of what, to me, Khalid's story really brings out, is that this power is already there within us and within our organizations. It's the way we set up our organizations that will ultimately determine whether we can harness that, not only in these moments when we have to flex up because of a demand like COVID or a major disaster in our area, but we can do so on a daily basis so that our staff and our patients are feeling that impact. Khalid, did you want to say something about that?
Yeah, I move on to the. By the way, Dr. Gupta, you want to walk us through this model?
Yeah. If you
and
don't
then
mind.
I'll add a few more things towards that.
Sure.
Yeah.
Yes, I wasn't sure if we,
Yeah.
we wanted to jump in there, but so this brings us to this integrate model that we developed because we felt that it's important to be able to talk about empathy and compassion and kindness and love They are all things that I think all of us here who are on the call certainly value because we're, singing to the choir. I'm sure we're not coming here, apathetic to this cause. But at the same time, we cannot allow it to just be a concept that's 20,000 feet up in the clouds and remains touchy-feely and something we can't get our heads around. We need to be able to show the world how we bring this down to the ground, not only in terms of impact and the kind of impact that Kala has already shared, and the impact that kind cultures can make in general, some of the statistics that he was talking about, but also in terms of mechanisms and tools and frameworks that allow us to take that 20,000-foot view and bring it to the ground level. So over the last few months, our Loving Organization Consortium has developed this integrate model, which is a 9-letter acronym that's allowed us to really, capture in a more concrete, practical, implementable, and impactful way, what does this really mean for me on a day-to-day basis? I still find in 2025, as much as we talk about systems, most people really don't understand systems, and it's a big struggle. So what we're trying to do is to help to create more visibility as to what are the 9 systems that reside in every organization. There are 4 people-based systems that are noted here. That's inspire leadership, nurturing the teams, and then we have transcend community and engage the people. So the first 2 at the beginning and the last 2 at the end. Those are the people-based systems. And then we have 5 non-people-based systems, which include things like trust, which is dependent on not only relations, but also informational systems, like the things that Khalid works on here. And then in the culture. How is that culture taken from a placard or a sign or a statement on the wall and actually brought to life? So embodying the culture. And then we talk about guiding management practices, the day-to-day things that need to happen in an organization, need to happen in a loving organization as well. That includes things like communication, feedback, accountability. All of those things are management practices that need to happen. It's just that in a loving organization, they can happen, in a more loving way. We can infuse that management system with a kind, empathetic, and loving approach. Then we have the policies, which is often a forgotten part of the organization. These are the formal and the informal practices of an organization, and they can somehow reflect whether we are taking a compassionate, loving, kind approach to our own people and to our patients, or we're just trying to follow the line and toe the regulatory mission and messaging, and then thereby somehow we always wind up disempowering our people if the policies are not implemented with kindness and love and compassion. Then we have the workflows. Khalid talked about some of them, but that's a really critical piece for us to think about. The way in which we design our workflows can be either infused with love and kindness, or it can be infused with fear, and it can create more of a burden to our people. And then I already mentioned the last 2, which is the people-based. So again, when these 9 systems, the 4 people-based and the 5 process-based systems come together, to us that represents the entire organization, and it allows each of us to now better understand this in a more tactical way. As managers, we all understand and operate these systems. We can start to think, what have I been able to do to allow each one of these systems to become more kind? And what can I do to make it more kind? So we can break it down at a level that then becomes much more understandable and implementable. Khalid, we can go on to the next slide, because then I hope to maybe share a few more examples with you.
Yeah.
I'm not going to talk about everything here. I realize that some of these slides are pretty dense, but our goal was to be able to at least communicate to you that there's a lot of thought process and mechanisms that have been involved here. With respect to the best practices, what we have been doing is we've been studying what we call loving organizations. That's where our nomenclature of Loving Organization Consortium comes from. We have identified 10 plus loving organizations in healthcare in the US, and we are trying to understand what they do and reverse engineer the methodologies. And based on that is how we develop this whole integrate mechanism to say, well, all of these loving organizations are essentially acting at the level of the systems. They're taking the responsibility at the organizational level. They're not pushing the burden of love and compassion and kindness back to the individuals and saying, hey, Dr. Gupta, you have to be more kind. They're saying, no, we as an organization are going to create a culture that raises the bar for everybody, recognizing that in general, most of us already have love and kindness and compassion inside us. We're just not being given the chance to actually play it out. So it's raising the bar, raising the floor for everyone so that we can operate at a higher level. And it's these systems that some of these are the examples that we've put here that our exemplars have illustrated a little bit later on, or maybe even the next slide. I do talk about some of those exemplars. But here, I'll just pick out, sorry, if you go back just a second, Colin, I'll just pick out 2 or 3 examples so you can see them. For example, in the leadership area, one of the strongest interventions that we've seen multiple of our exemplars exhibit is shared governance. And that's a way to get participatory, inclusive governance, so that the people that are being governed, so to speak, the staff themselves, oftentimes in the healthcare world, this is really being led by nurses. It's that the staff nurses, the frontline nurses, the nurse managers are being included in the process, so that it's not that some decision making is happening at the executive level and then being rolled out to the front lines, but that the front lines have a say. One of my favorite organizations in this capacity that's really setting the bar in this is Baylor Scott and White in Texas. They have developed a high order 2.0 shared governance model. Probably you could call it even 3.0 in terms of the number of unit practice councils that they've deployed. And now they've expanded from well beyond nursing to therapy and pharmacy as well as physicians. So this is a very well proven intervention. And again, just an example of a systems-based approach to improving leadership. So it's not just extolling leadership to say and imploring them to say, hey, you as an individual leader need to be more loving. Certainly, we all as individuals can be more loving and kind, but it's also about saying, here's how we're going to support you in doing that by creating systems that enable it. So that's one example. Another from the team section that I'll pull out is something that I implemented when I was chief medical officer at a hospital. That's a real-time conflict resolution system. What we recognize is that oftentimes on a daily basis in the walls of our hospital and our floors, our staff and our patients are experiencing real-time conflicts. Issues of, I don't want to be discharged, but you think I'm ready to be discharged, and now there's an issue, or I want to go home and you're not letting me go home. It could, take a variety of forms. It's sometimes between doctor and nurse, or it's sometimes between nurse and patient. And so what we implemented was this real-time conflict resolution. We called it a conflict response team. Similar to those of you who are on the clinical side may recognize, we have rapid response teams. This was a pager mechanism that myself as the chief medical officer, my chief nursing officer, and our patient safety quality officer, and our chaplain would all carry that pager. Anybody could just call the pager when they were experiencing a conflict. And now we would have actual administrative additional resources being brought to the bedside to help resolve that conflict, to help people understand what were the tensions that were underlying it that could potentially be boiling over. Now, it's still just about the people. It's still about relationships. But the systems-based approach here is setting it up in such a way that enables staff to be able to call upon the resources that they need and bring them to the front lines. When so many of our staff complain, well, we've got bloated bureaucracies and so many executive layers. Well, what are we as executives doing to try to help that scenario? So that's another example. We've got plenty of other examples. I wanted to share them with you here so you can see them. Certainly, I'm not going to have the time to go over them. That wasn't our intention, but we do want to bring them up here for you. And if you'd like to learn more, please contact us.
Thank you.
I think this one is also for me, Khalid.
Yeah.
I'll go over this as well. I mentioned the exemplars, and I mentioned that we have 10 plus healthcare systems. These are 2 of them, 2 of my favorites, but I have others, like I mentioned, Baylor Scott and White. University Hospitals, led by Dr. Peter Pronovost, is one of the finest examples of loving organization. Peter Pronovost is a luminary in the world of quality and safety. Many of you have probably heard about his work in the ICUs and in surgical safety. And now he's the leading proponent for leading with love. And now he's at the Chief Clinical Transformation Officer at University Hospitals. And through his leadership and the mindset and heart set change that he's brought to University Hospitals, they've had dramatic impact across the board in quality, in safety, in throughput, in patient experience, in profitability. And the greatest thing that struck us when we studied university hospitals and other loving organizations is that they're doing this by actually decreasing burnout and decreasing turnover. So they're not improving outcomes at the expense of their staff. They're delivering improvement in outcomes with their staff. That is what a loving organization essentially is about. And that's how we think kindness really translates inside an organization. I'm not going to go through all of the individual parameters, but we're sharing them with you here because certainly sometimes we're challenged when we're talking about these principles and concepts and tools with colleagues and trying to convince them about where's the data. So Khalid has shared some of the data, and I wanted to bring some of the data forward. Another great example is St. Luke's University Health Network. This is in Allentown, Pennsylvania. Again, one of the finest examples of a loving organization. Their CQO, Donna Sable, who I've personally had the pleasure of spending a lot of time with, interviewing her on this, as well as her CEO, who's the longest standing CEO in healthcare. I think 39 years has been the CEO of this system. The two of them together have been building this loving, what we call loving organization, we can call empathetic or kind organization over a long time, but they have created this incredible culture in which they're truly seeing engagement go up, turnover go down, a reduction in safety events, and improvement in patient experience, to the point where they feel that this is the reason why they're able to compete in the market, and they're actually winning market share from other competitors because of it. So this is real, it's impactful, it's already happening. That's what creates excitement for us, is that we're not just talking about theory, we're talking about reality, whether it's Khalid here who's doing the work at Santa Clara or these other colleagues that are doing the work around the country. It's just that the work is still at an early stage, and most people have probably still not heard of it. Our organization itself is also at an early stage, but our goal through the forums like this is to bring this message out and to make more people aware that there is an alternative to fear-based management, that there's methodologies, and those methodologies are deeply steeped in systems-based approach that the organization can take on, and when they do so, it's going to lead to dramatic impact. Khalid, any comments from you?
Sure. I will speak about next slide. But one thing, as I'm watching you and listening to you as you were speaking, I mean, your enthusiasm about this philosophy is infectious, really, especially in the time where we need this the most. Perhaps people who are following the AI news may have read this report. Came out about 8 months, 10 months ago, within the last year. There was research done between doctors and the LLMs, the large language models, and the result was to some extent shocking, because doctors are supposed to be kind and compassionate people by design, like by training. But what research found out that ChatGPT, especially in the communication, especially writing notes, was far more compassionate and empathetic than the human beings. And there are some reasons for that. Uh, for example, a doctor in the hospital has so many pressures going on, so many things to do, not only within the 8, 10 hours of the hospital or 12 hours, but also after the fact when going home. And that takes toll on that. So the point that I want to make it here, that even the most educated people with the best of the intentions can forget that kindness should be the core of the services we provide. So intent is very important. What your framework does, our framework does over here, is that it kind of reminds us, it gives us a checklist. When we were conversing, Dr. Gupta, you made a really good example, simple but very profound, which is that when you frame a picture, it's the same picture, and suddenly start giving a different look. It's a different way that you visually interact with that. It's a different way that it adds to the aesthetics of the place where it's being hanged or placed on the desk. It was just one frame. So when we talk about the structures and frameworks, that actually bring, when you read these words, which are mostly verbs or adjectives, many of us do them. But when you find a framework like that, it gives you really a structure, and also reminds you in your busy, when so many demands are pulling your brain in multiple directions. When you have these 8 things written or 9 things written in front of you, you know that you have to do that. So what this framework, among many things, bring is the intention. So that everybody that is engaging with very caring situations, like taking care of patients, especially when they are having so many troubles, to remind the care providers that there is a human on the other side. There is no some object that you have to just deal with in 5, 10, or 15 minutes.
That's great. Love that.
So the impact of kindness. I shared a couple of examples when I was speaking earlier. For every aspect of this framework, there could be an example. Few things that I want to share. that we have done, and there could be many examples, but I want to be sensitive about time so we can get a little bit of chance to practice this in this forum. One of them is, for example, and I don't won't go any particular order because there are so many things to share. One of the things that we do, which is very important, which also ties to emotional intelligence, also ties to psychological safety, that also ties to the culture, the positive culture or loving culture we create, which is a feedback loop. That is very, very important. So one of the things that we have suggested here that create multiple safe channels for staff input, and we do that intentionally and make sure that it happens every day. Like for example, my given day or week or month, we have multiple forums for the staff, and part of them are like open office hours. I have after office hours if somebody wants to talk with me at my own expense and on my time. What I mean. We also have open office hours that any can one can drop in, but still there are many people that don't feel courageous enough to come and tell us that what we are doing wrong. For them, we have created multiple channels. There are structured surveys that happen few times a year, at least once a quarter. But I also have a form as my email signature. Very simple thing that to help with technology. It's a Microsoft form. They click on that and it's anonymous. Anybody can send me anything. And sometimes I not sometimes, oftentimes I get some comments, and many of them are valuable. And then we figure out that if they are general, the challenge with the anonymous feedback is that if it's very specific, you cannot seek the details. But if it's general, like we are spending so much time on meetings, that is something that you take seriously and start addressing that. So these are the continuous feedback loops that we employ in our environment and that help us to do better. For example, few months ago, I got this feedback that I should make myself even more available beyond everything, and I took it seriously. I started making myself more available. I'm here in a confined in office, but I'll make sure that at least once a week I go and sit among the cubicles where everybody's doing. I just finish my day over there so I can have not only osmotic communication, but also a visual availability to the people that if they want to interact with me, I'm available to them. So these are like simple measures that we can do. Few other things that we want to share about is, meeting rituals. I had this thing that I was personally proud about, but having created psychological safety to some extent, one person, and I respect her very much, even more so now, she came to me and told me something that I was doing as a great thing, but in after fact, I realized that wasn't so great thing. And the thing is that I don't take lunches. So my day starts at whenever I'm in the office, it goes all the way to 6 or 7, depending on the work. And I had this habit of treating the lunch hour as a regular hour. And I used to call meetings. And one day, a lady who's a leader in my team, a manager came and said that, we understand that you don't take lunch, but we do. And this is an important hour for our day where we unwind, we interact with people, we enjoy our little time with each other. I say, I am so sorry. That was perhaps my blind spot. I was taking a pride that I'm so productive, so efficient that I'm not wasting a minute. But there was a huge toll that was being incurred on my team. That was the last day I had the meeting, and after that, I canceled. Not only canceled, but I created this culture of the new meetings culture that we have done. One is to minimize them. One is to not to have the full hour meeting instead of 50 minutes, giving 10 people 10 minutes for people to reschedule or not reschedule. I mean, uh, use restroom or whatever they want to do or move from place A to place B for that meeting. But just this one simple thing, and where it comes from, when you start giving value to the feedback of the people and also creating a forum. In many areas, even now, I might be doing something that people don't feel comfortable in telling me. That's why I have the anonymous channel. So there are so many things as leaders we can do simple, but they bring a lot of value to the culture of the organization and also well-being to your staff. So they are not cringing like they were sitting in the meeting during the lunch hour, cringing that when this guy will end so I can go and have my lunch. So there are so many things that could be done. I can go on, but I will invite Dr. Gupta again to take us through this exercise.
Yes. So we were hoping to make this a little bit more interactive. I don't know, Billy, it looks like we have probably enough people to have maybe a couple of breakout rooms. Give you folks a chance to take a breath and think a little bit about the materials that we presented to you. What we would like for us to do in the breakout sessions, we probably don't have a lot of time for this, but say 5 minutes in each breakout session. Pick one of the elements of integrate in the breakout session together and think about how could you design that element in a way that would allow it to be more structural. It could be a change in the workflow or policy or technology. And of course, all of you work at different organizations, so it may not necessarily be reflective of one organization. But we do think it's a helpful exercise to go through this together. And then think a little bit about how will this create psychological safety for our staff? How will we measure that this is working? And how will we ultimately model this by leadership to show that this isn't just a fad of the day? At the end, if we have some time, maybe we'll get some of you to speak up, just share your thoughts. Again, we don't need to make it too overly formal, but we'd like to, let's say we go for 5 minutes till 1:52. Bailey, are we on track for that?
Yes, I can open the breakout rooms now.
Wonderful, thank you.
And those who want to see that what the integrate model was, I will go top here. So you see what are the different elements. Join room one, so we can go to the.
Yes. What's our next slide?
We want to hear from the audience here.
Yes.
So
We just a couple of them. Do you mind asking? Yeah.
yeah, so I hope you had a good conversation in your breakout rooms. Dr. Gupta and I were also in one room and had really good interaction in 2-3 minutes. Like we talked about at least 3 aspects of the framework that were related, but also very impactful. Anybody wants to share the feedback based on their conversation in their breakout room? For example, we were saying that one lady, pardon me, I didn't get the name. Engage was very important for them. That you, Julian, my apologies, Julian. Engage was very important to them, and I was sharing there that inspire is a broad subject, but if you start with humility, then engagement automatically follows. So they go in step in step. And Jean was saying that align is also very important. Not sorry, align, but engage, right?
Align.
Align was important that you have to make sure that your methodology is understood and followed by the people and it aligns with them or their aspirations. Anyone else wants to share? I spoke too much already.
Well, I think on the align one, I was just saying that we can't assume that other people operate the same way that we do. And so it's important to allow the space for people to set up their own way of accomplishing whatever the goal is.
Yeah, totally agree. I think that's awesome. I love it. And I think the way you were thinking of Align, Gene, as you were saying in your comments in the breakout, is that they're all connected. They all pull from each other. And so, we don't, again, want to get caught up in the semantics. We like frameworks and they help us, but we don't want to get trapped by the frameworks, which is why we could say, hey, we've been implementing systems for decades, but the systems are not going to help us on their own. It's the intention behind the systems. So understanding how you're using Align is really the brilliance of what you said. Julianne had said something in our breakout about is there a particular order in which you would do this? Because she felt she would want to start with the engage with the people, and Khalid said I might want to start with the inspire, and for Jean it might have been align. I actually, when we try to do this work with organizations, we start with embody the culture because we like to look at we're all coming together for a purpose. We're here working together for a reason. So what is that reason? And if we can all remind ourselves of that reason, then we can think about all the other things. But I'm just stating one particular point. It's again, it doesn't have to happen in any particular way. I actually really love how Jean and Julianne and Khalid and Janice had described what they're doing. I don't know if others are here, but from the other group, anyone quickly want to share? Don't want to shortchange the other work group that we weren't able to join.
One thing very quickly I will share if nobody else is sharing is that I think embody our culture value is very important. So a few years ago, we went through this very quickly transformation where different groups which were not historically supporting healthcare, which is 24/7 operation. There's an urgency, things needs to be fixed now. That culture was missing. And we really struggle. Like if I pass on a ticket to that team, to them, it was ticket that, well, if it got fixed now, so what? And 2 hours later, like if your printer is not working in the back office, it could be done 20 minutes later. But if that printer is not working on the nursing station, the impact is now. How to cultivate that culture that they understand that what is the urgency of that. So finally, I came up this idea that I brought those teams in different groups and made them round the nursing station and hospital. We went there, we sat down, we observed, and say, look at their lives. If the label is not being printed, it means the blood is not being drawn. It means that patient is waiting on the results. It means their well-being is being delayed. Over a period of time of iteration of almost a year, we have created a culture. Then a ticket comes to the back-end engineer, they understand. They are not on the front lines. They are not seeing visually the nursing station, but now they connect the dots. So sometimes you have to expose them the true reality of the business for them to react accordingly.
Beautiful. Yeah, that's exactly the culture thing.
Culture.
It's like coming back to the mission for us. So we have only 1 minute left, actually, and we have a bunch of things we could have shared, but just want to pause here and see if anybody has any questions, thoughts, feedback. I know that Cassie had put something in the chat that I wasn't able
was
to
there?
see, but is there anyone else want to comment on anything before we have to close up?
I think I will just jump in to remind folks to make sure that they do the evaluation that will pop up at the end of the session, and that if you need chess credits, to be sure to include your number. But I want to make sure that I join Cassie in thanking you all for the presentation. Really great practical messaging in there, and really easy ways for us to see how we can apply the integrate model to our specific
Thank you.
real world situation. So thank you very much, and thanks everybody for being such active participants.
Thank
We
you.
appreciate you all. Thank you.
Thank you. And only so much we can cover in 60 minutes, but many of you are actively in this work. So please reach out. Let's talk more. Let's continue the conversation. Thank you.
Thank you
And
so
thank
much.
you, Khalid, for being such a great
Likewise.
partner.
Thank you. Thank you. Bye.
Bye-bye. Thank you, Bailey.